Hi there, welcome along. This is Paul Gough, one of the UK's leading physios. Today we're going to talk all about calf strains, or more specifically the problem that you have probably somewhere between your knee and your ankle, right in the muscle. Somewhere between your knee and your ankle is your calf that is likely to be causing you pain or causing you restriction that is stopping you living your life, doing the sport that you want, going for the walks that you enjoy doing, or just getting out of bed on the morning pain-free. So we're going to talk about what a calf strain actually is, why it can be a problem to you in your life. We'll also look at the real big problem, not just the pain that it's caused by a calf strain, and we'll look at how physio can help. I'll introduce you to myself. That's me. A little bit about my career in the past. I used to work with Darlington and Middlesbrough football clubs here in the northeast. More recently, I've been travelling, doing a little bit of work with players such as Paul Scholes from Manchester United, working at his soccer academy over in Orlando, Florida in America. So calf strains, the real problem. If you have a quick look at the image, you can see that's specifically and typically where a person who damages a calf muscle will instinctively and intuitively head for. So when you feel that pain and person, I've tried so many people who say to me, God, I felt as though I'd been shot in the back of my leg, and that is usually a real description of somebody who's irritated, a calf strain. But that's not the real problem. The pain is an issue, but a long-term problem of these calf strains is this thing called scar tissue, and if you're not careful, this calf can end up so tight that it can actually lead to pain in your Achilles. Again, just have a quick look at the image. You'll see I've highlighted the Achilles area there. Scar tissue, this is this thing that when you damage your muscle, within 4 or 5 days, your body is starting to put down this thing now. It's like a glue or a cement. So if you imagine if we damage something or you break something at home, you'll probably use a glue or a cement to fix it. And it's the same thing. So your body will put down scar tissue to repair this damaged calf muscle. The only problem is if it gets left and too much scar tissue gets put down, these calf strains become a real long-term problem where you feel as though you're just never going to be able to shake them. And then, as I say, longer term, expect problems with Achilles if these things don't get sorted out pretty quickly. So first we'll confirm that you actually have a calf strain. That's the image that I'm showing you is of the anatomy of the calf muscle, and that's typically where a person will end up with problems just above the Achilles. It might surprise you to see that white thing that you can see is your Achilles tendon, how long that thing is that goes all the way up the back of your leg. So if you've got a calf strain, you'll have had an immediate sharp pain in the back of your leg. Like I said, I've had some patients describe this as if they've been shot in the back of the leg, or somebody's threw something at the back of the leg and they've kind of looked around to see that there's nothing there. So you'll more than likely, when you were running, you were playing football, you were walking, or you slipped and your calf stretched too far, you felt this immediate sharp pain in the back of your leg, and that's usually what a calf strain is. It can be painful even standing on your tiptoes, so it shows you how weak that calf muscle is, and it's likely to hurt when you push your fingers into the muscle just below your knee. Somewhere between your ankle and your knee is this muscle. You might read on the internet it's called the gastrocnemius muscle, gastrocnemius, and it's a really big muscle. It's under a lot of stress because it's having to control pretty much everything that your body wants to do. Goes through the calf and the Achilles area. And one more giveaway of this type of injury, swelling and bruising. Again, quick look at the image, you can see what can happen. Now that swelling and bruising can happen as a result of a tear to the calf muscle. Now, although the calf muscle in this instance is likely to have been damaged a little bit higher up, this bruising and this swelling drops, and we call it tracking. It tracks back down towards the foot. So don't be surprised if you have a little bit of swelling at the bottom of your foot, ankle sort of area, as a result of this calf strain. So what is it? Well, basically it's a tear in one of the muscle fibers. Again, it's called the gastroc. We sort of loosely call it the calf muscle area, but you might read that it's called the gastroc muscle, and it's in your lower leg, somewhere between your ankle and your knee. Is it torn or strained is a question that I get asked by my patients quite regularly. It doesn't matter. It's exactly the same thing. You only really need to worry about it if it snaps completely. So a torn or a strain just means that the fibers have been stretched. The fibers that make up that muscle have been stretched too far and too fast. Again, a really simple way to think of it is an elastic band. If you were to pull an elastic band really tight, it would probably twang back into place. But if you pulled it extra tight, it's a good chance that it would fray or it would snap. The Achilles or the calf can snap, and very common, it can fray. So again, think of it like that. And if it was to fray, the body uses this glue, it uses its cement, this thing that I mentioned earlier called scar tissue. Put down too much scar tissue, or put down too much glue, put down too much cement, and this calf muscle is too strong, too tight. And that usually is a person's problem, is that not that this calf muscle doesn't heal, it just heals wrong. So why are you getting the pain and the restriction? Well, the fibers are torn, so whenever you tear anything, any form of muscle or any ligament, it's immediately going to be painful, and you'll get the swelling That swelling that you're getting in the area, you can probably look at your ankle or look at your calf and think this is a little bit more swollen in comparison to the other. It's there to make you immobile. It's your body's original defense mechanism. It wants to slow you down. It wants to stop you going for a walk. It wants to stop you playing football and bike riding and other things that you love to do, because it needs time to heal. So you need to give it that first 4 or 5 days for this swelling to happen, and that's why it's important to use your ice. Always use ice in the first few days of any injury, and then why it's so important to get on with your physio pretty quickly, because we need to get rid of that swelling, that bruising. We need to start realigning these fibers, and we need to stop the scar tissue becoming a problem 4, 5, 6 weeks down the line. And that's often a problem that we see, is that a person will rest this type of injury. They'll rest it for too long, and by the time we get our hands on it, it's so stiff and it's so tight that's the reason that they're in the pain that they're in. So it often heals wrong, and that causes your restriction. You kind of you're out of your initial pain, but you want to get back to your walking in the woods of Guisborough, the hills of Durham, or on the flat in Darlington, or just go for a walk along the seafront in Hartlepool somewhere. But this calf muscle is now so tight, it doesn't want to let you do it. So you stop, your pain stops, but your activity increases, your pain increases. So you're on this vicious circle that you kind of can't get off. So how can physio help? Well, hands-on physio is the only way that you can get relief from this type of problem without it being a real major long-term problem. So hands-on physio from us, you need massage, you need stretches, you need really, really deep tissue massage for us to help mobilize and get this scar tissue as flexible and as mobile as possible. Again, keep thinking about that elastic band. You need just enough flexibility in there. We'll give you a good explanation of your injury. We'll confirm that your calf injury is nothing to do with anything like a sciatic nerve or any problems that are being caused elsewhere. It could even be something to do with your footwear, your position of your foot and things like that. So we look at that and we'll talk you through all of that. We'll give you exercises to do at home. Vital in this type of injury. On their own, not 100% effective. Combine exercises with hands-on physio and you will likely get a fantastic response to treatment. So calf strains are so simple for us to sort if we can get our hands on them early days. And we'll advise you on footwear and exercises and things like that you can be doing to help yourself at home, because it is a common injury, let's say in a person who's 40 to 60, is very active, is sporty, but also in somebody like a female. If you're watching this video right now and you forever wore high heels and you've swapped and you've gone into flats, or you've been on holiday recently and you've swapped from high heels to sandals and walked along a beach for 2 weeks, it's going to put that muscle, that calf muscle, under a stretch that it's not used to. Again, refer back to the elastic band. It's like pulling an elastic band constantly for 2 weeks. Eventually it would strain or it would tear. Worst case, it would snap. And also from physio, you'll get advice on when exactly it's safe to return. It's one thing returning to your walking, to your bike riding or to your footy, but it's a different thing to return safely. And one of the real values of seeing a physio pretty quickly is that we can guide you safely back to activity. We can probably also let you go back to swimming, to bike riding, to yoga, to Pilates, things like that, much sooner than you would have thought possible. Maybe not the intensity that you would like, but we'll get you back to sport or get you back to active as quickly and as safely as we can. So in brief, it will take about 3 or 4 weeks to recover from this type of calf injury. You're probably going to need about 3 to 4 sessions, made up predominantly of things like deep tissue massage, stretches, and we'll give you exercise sheets that you can take away and you can work on, and you can sort of work on them through the week. But predominantly a physio session with us will be with deep massage and stretches. Our clinics, we're in Darlington, we're in Durham, Guisborough and Hartlepool around the northeast. You can call us, you can usually get an appointment within a few days. If it's so bad, we can see you literally within 24 hours. So please feel free to give us a call as soon as you need to. If it turns out that we can't help you, we always give you this promise that you'll get your session free if physio can't help you. If it turns out that it's something, it is completely snapped and there's nothing we can do, or it's a problem that's just nothing for physio, but we will tell you who to see and who the best person is to solve your problem, but we never charge you for your session. So to get to us, call 0800 043 8671 is the number you need. You can speak to one of our secretaries. The girl that you can see in the picture that's in our Hartlepool clinic is Vicky. She will be waiting to take your call, and we can get you booked in for your physio sessions as soon as you can. So just to recap, for a calf strain, you need hands-on treatment. You'll get an explanation of your injury and what's happened and how you can reduce the chances of that injury happening again. You'll get exercises to do at home, and we'll also tell you when it's exactly safe to return, and we'll slowly let you go back to activity. Like I say, if you want to get back to your walking in Guisborough, or your bike riding in Guisborough, or running in Durham, or you're walking along the beach in Hartlepool, we'll tell you exactly when you can do that and when it'll be safe to reduce the chance and nullify it almost of that injury happening to you again. So physio can definitely help if you have a calf strain. And like I said last time, you need the number is 0800 043 8671. Thanks for watching. I hope this helps. Take care and I'll see you soon.